I'm sure if you open your email, it'd be there.
And if it's down to only
Yeah, and then the ones they paired them up with, you know, they basically put two districts into one.
But I thought it was highly pertinent to the
Paired them
discussion.
up.
We'll get people
I
out.
think You're Johnson 274.
I am. That's my old local youth.
Actually, I skipped over the part that said Jeff Johnson and pulled up the document right.
Being 7 o'clock, I'll call the Marathon County Board of Supervisors to order. We will start with the Pledge of Allegiance. Please remain standing because following that we will have a moment of reflection. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. We will have the reading of the notice, please.
The adjourned organizational meeting of the Marathon County Board of Supervisors, composed of 38 members, will convene at the Marathon County Courthouse, Assembly Room, 500 Forest Street, Wausau, on Tuesday, June 25th, 2019 at 7 p.m., and the agenda was duly signed and posted.
Thank you. I would like to request all to please put your electronic devices on silent or vibrate as to not interrupt the meeting, and thank you. And we will proceed to roll call. I invite all the supervisors to sign in. And we will proceed. And I would like to welcome all of the visiting guests that we have here, along with our viewing audience. And we will move on to item B, educational presentation reports. Item number 7, update on the work of the Aging and Disability Resource Center of Central Wisconsin, Jeanette Arms and Tim Butke.
Remember about a year ago, I had the privilege of introducing Jeanette to this body, and Chairman Gibbs introduced me as the chair of the ADRC. I was not at that time. It was, but maybe it was a premonition, it was foreshadowing, because I am now. So here I am. At any rate, a year ago, we had the privilege of hiring Jeanette Arms to be the executive director of the ADRC, and I think it was one of the more astute moves that our organization has made. She has taken charge and empowered the staff to a great degree, but I think we're headed in the right direction as an organization and have a great opportunity to grow going forward as well. Her connections statewide have been invaluable to the organization, and we fully expect it to grow as we go forward. So with that, Jeanette.
Thank you, Tim. Good evening, everyone, and I ask your patience as I do something a little bit different tonight. I just want to thank you for the opportunity to allow me to come before you again. I would like to recognize Chairman Kurt Gibbs for allowing me to be here, and also Tim Butke and Sandy Seelar, who represent Marathon County on the ADRC Board of Directors. Chairman Gibbs, Supervisors Butke and Seiler, I just want to say thank you very much because you have been an enormous support to the ADRC and me since I started, and I know before I came aboard. Also, Brad Carger, who without, I know that I would not have made the strides that I have made within Marathon County. You made sure that I was connected and involved and always found a way to make the ADRC feel a part of this government organization. So thank you very much, Brad. It has been a great 15 months, everyone. So as Tim mentioned, it has been a year and 3 months since starting and almost 1 year since the last time I came before the board. Today, I brought with me our first annual report, which you have in your board packets. And I am not going to bore you with reading this data that you can actually read yourself. Instead, I would like to answer any questions that you have, and I want to let you know that I did bring my staff with me today. We have served over 7,000 customers in 2018, and it's because of the work they do in partnership with you and the rest of the community. So I ask for my staff to stand up, and I just want you to really quickly give your names and your titles. Introduce yourself loudly.
I'm Mike Ray. I'm our Director of Resource Center Services for our 4-county region.
Rhonda James, Nutrition Program Director, 4-county region. My home office is here in Wausau.
I'm Peggy Kurth. I'm a community health educator based here in Wausau.
Jenny Pagel, Resource Specialist here in Marathon County.
Kathy Lemons, a Resource Specialist in Marathon County.
Janae Belmis, I'm one of the Elder Benefits Specialists in Marathon County.
And I'm Pa Tal, I'm the Quality Manager for the 4-county.
Thank you very much. They are the faces of the ADRC, and they are the people that our community knows. For Marathon County right now, people 60 years plus make up about 20% of the county's population, and by 2040, we are looking at the population increasing by another 10%, which will bring us to 30% of our population. Additionally, we have approximately 12,000 people 18 years and over who identify as having some type of disability. And that's why the work of the ADRC is essential to our community's success. Since joining the ADRC, I have worked with department heads and numerous local partners to be more visible, and this includes helping to plan community events, being the voice at the table for ideas and information, sharing, partnering with the media to help bring awareness of our services, and among taking advantage of many other opportunities, I'm leading the charge to raise the voice of adults who are aging and disabled through unique advocacy opportunities. And that's a big change for the ADRC. Now, however, it's really not about me. I brought my staff for a reason. This is a new experience for them. And because I do not do this work alone, it takes you and the entire community, and most of all, the wonderful staff of the ADRC to get things done. These are the people who are out there beating the pavement. They are driving on dirt roads every day, and that's why I asked them to join me here today. They are the experts. They're the people the community recognize, and they are the reasons why our seniors, older adults, people with disabilities are thriving today. And I would like each of my staff here, I would like Jenny Pago, who's a resource specialist, and Peggy Kurth, a community health educator, Rhonda James, our nutrition program services director, to come up here, hurry, and join me. And before I end my presentation and have you ask questions of me and our work, I'd like for Jenny, Peggy, and Rhonda to share some very brief stories of their work.
Whatever works. I want to start by sharing that I am a lifelong resident of Marathon County. I grew up in the tiny community of Milan on the western side of the county. Yay. My husband would be jokingly saying to you that he went across the river to find a wife and moved me to the eastern side of the county where I live now. Until I began working for the Aging and Disability Resource Center, I often drove through our county, paying little attention to the people that make up the landscape of this beautiful area of the state. Then, as I started meeting with people through my employment, I quickly began to realize that there's a story behind every single door that you and I pass as we're driving through this county. At the ADRC, we're often invited into a person's home when their family believes it's time to consider Meals on Wheels, or they're nervous to broach the topic of Lifeline with their stubborn German grandmother. It's during these home visits that we learn the stories of the people who made Marathon County what it is today. We meet with veterans of every war, with farmers who have farmed land that's been in their families for over a century. We meet with parents who have quietly raised their child who has a disability and are now nervous about them entering an adult world as they approach the age of 18. I've gone into home visits assuming I was going to talk about Lifeline, only to find out there's a person in the home living with dementia and a caregiver who's falling apart under the stress. I recently met with an 89-year-old mother who has a 71-year-old daughter with a developmental disability who told me I help her mentally and she helps me physically. There were no plans in place should either one of them have a crisis in which the other half is no longer part of the equation. Through a long conversation with them and another family member, family became aware that they needed to develop a plan should either daughter or mother have changes in their health. We were able to set up Meals on Wheels for both of them to relieve the burden of preparing meals from the mother. Private pay home care services were set up to ensure that both were getting showers and housekeeping needs were met. They were connected with a healthcare provider to ensure that their powers of attorney were in place. The overwhelmed family has indicated that they're now much more relaxed, knowing they have safety nets in place should the situation change. These are all stories that are hidden from us. Lives that go on living behind the doors we barely notice each day. Our role at the ADRC is to find ways to bring services to these doors, whether they're within city limits or in the outermost corners of our county. Our role is to make people aware of the challenges that these quiet individuals face on a daily basis and to find ways that they can continue to reside in the homes that hold their memories, their pride, and the foundations that they've laid for all of us. Marathon County is a great place to live, and hopefully that's true for all residents, not just those of us who are able to walk out of our doors each day.
That's hard to follow, Jenny. I just wanted to, I'm a community health educator at the ADRC, so I work with older adults and adults with disabilities in providing some educational programs that are evidence-based to help them hopefully lead really healthy lives and then continue to be independent and active in their community. What I wanted to share today is a personal story of how the ADRC was very beneficial for me in helping my parents. Again, I've been at the agency 13 years, and until I started working there, I didn't know about power of attorneys for healthcare or finances, wills, and how important it was. So through the years, I managed to convince my parents to get all of those documents in place for the planning. And it came in very handy. My mom currently is 89 and in pretty good health, living independently. My dad passed away last November. He was 87, and unfortunately, his health was not as good. He had polio as a child, so had had over the years many falls, which in the last 7 years of his life became increasingly more harmful. So he broke hips, ribs, shoulder, had lots of head contusions, black eyes. And through the process, staff at the ADRC, actually Jenny came out and met with my dad, who was a very stubborn German and cantankerous. I think she met with him 3 times to get him willing to be screened for family care because my parents did not have the resources to pay privately. And in that process, he was able to stay in his own home through last August by getting some assistance in the home, which really helped my mom not fall apart. Unfortunately, then he ended up with some pretty serious falls and ended up in the hospital and rehab, and then passed away at Mount View. But I also have to say, and I know Janae's back there in the audience, I've also been able to tap into working with our elder benefits specialists in dealing with Medicare bills or ambulance bills that are being denied by Medicare due to some inaccurate coding. You know, this is 4 or 5 months after my dad has passed. My mom can't figure it out. She's very confused. So it's just amazing to me with working there of how difficult it is to work through these systems, that I know for a community member who doesn't have some of that knowledge, how important our services are to them.
Good evening. I'm also an almost lifelong resident of Marathon County, lived out of state for just a bit, and I have a story sort of similar to Peggy's. I'm not going to share in detail with you tonight, but my grandmother passed away in January. She was 91, and she would not have lived in her home independently and staying out of a very expensive facility till her death in her home without the support of the ADRC. And a few different facets, we offered service as an organization to her. And my other grandmother also received services and stayed in our facility here in Marathon County until yesterday, and she left us on this earth and passed. And they both benefited so much from our ADRC services. I have a couple little notes I want to share with you today. You know, we deliver Meals on Wheels throughout Marathon County, and I think Jonette talked about the dirt roads. Our folks drive down every day to deliver meals. So we're not just delivering Meals on Wheels in the city, in the Wausau Metro. You know how big Marathon County is. We're out there on those back roads, Monday through Friday. I have a couple notes of thanks that I'd like to share from either customers or family members. Thank you so much for providing this service to my dad out in the country. It's a priceless gift we never take for granted. Thank you, and thank you. Thank you so much for offering this service. Mom really enjoys the meals, and it is such a comfort for me as I battle cancer to know that Mom is getting a healthy meal. So daughter is a caregiver who is dealing with her own health issues with cancer, and the Meals on Wheels are a big support to her mom. And lastly, thank you so much for the meals you provided for Dad until he moved to an assisted living facility. The friendly service provided by your driver was something he looked forward to every day. And often the driver was the only person that he talked to that day. It would be hard to get along without them. So just a couple samples of the really cool stories and thank yous I get to see really pretty much every week. So it's just one little aspect of what the ADRC does. It makes a big impact on helping our customers stay independent living in the community.
Thank you very much for sharing those stories. I just wanted you to be able to connect more with us through a variety of stories that our staff actually experience. And these are 3 individuals who actually represent the 71 employees of the ADRC. And I'm very happy that you were here today to share those stories and your experiences as a customer, as an employee, and as a receiver of gratitude from our wonderful customers. So I know we have a big agenda today, and as I close, understanding that we have many hidden communities of thousands of adults who are aging and disabled, and the numbers are going to continue to rise. I would ask that you continue to recognize the benefits of the ADRC through your support, and if you are interested in knowing more about the ADRC, please feel free to reach out to me. I have business cards available for you. I also creatively left my annual reports, our Choices news magazine to help you keep up to date with what's going on, and our regional resource guide, which has numerous thousands of resources about different services and programs that are available to you and your constituents throughout the county and region. Last but not least, during October, I'm just giving you a heads up, the ADRC will hold a community open house. I think this will be something different for us and the community, but we want to welcome the community to the ADRC and allow them to visit, ask questions, learn about us, and other supportive community services that we partner with. They will receive health screens and some tasty refreshments, and you will be invited to come also. It will be a fun day, and more information will be coming really soon. So are there any questions? Yes, sir.
I've got two comments and one question. I want to compliment you on your annual report. I think those are great. They tell your story. There's something you can leave behind, and it has lots of facts. So I appreciate that. And as a driver of mobile meals, I know what it means not only to the people that you deliver meals to, but it also as the person making a special day for these people. So my question is, when I look at your funding, your revenue stream, you've got the category that are grants, donations, and grants. And are these recurring grants, or every year do you have to go out and keep raising money in that capacity?
Well, what we have are with our nutrition program, we are required to ask for a contribution from customers who receive those meals. So that's donations or contributions from those meals that are served to our clients. And we get very small grants from time to time. And yes, we do hunt down grants, and that's just to fill small holes that we may have. This year, I went hunting for a few grants from local private foundations to get us some new Meals on Wheels vehicles, and was successful in doing that, and that's something unique. People don't like funding federally funded organizations, but we do have holes that we need to fill, and one area is with our Meals on Wheels program especially, and those contributions really help, and you can see that's a big chunk.
Supervisor Schaefer.
Thank you, Mr. Chairman. Following up on the funding source, you have county tax level $858,000. Is that amongst the 4 counties, or is that strictly Marathon County?
That is among the 4 counties.
You know what Marathon County's share is, or?
It's the most. I don't have it offhand, but I most definitely can get that to you.
Well, it might be in the annual report, so I just don't see it.
Okay. Point out it's been the same for the last 10 years.
So yeah, let me put in a plug. You're making it too easy for me. So we have received flat funding for over 10 years. And that's from the federal and state government. And when we became a regional organization in 2011, the tax levy that we received from the counties, we have not received an increase since that time. And with the growing aging population, I am not sure how long we're going to be able to last being funded at the rate that we are. So I will put it out there openly that at some point, I do have to talk to my other counties about it, but I will be coming back to ask for an increase. So I'm the new girl. Why not cause upset, right? Yeah. Mm-hmm.
Supervisor Guild.
Thank you, Chair. I just can't help but notice on the very first page of your annual report, you talk about volunteers, and Marathon County seems to be a little bit behind on this particular item. Can you maybe give us a sense of what's been done, and what, if people want to be volunteers, what does that look like? What could they be doing, and how could they get involved?
Sure. So we regularly recruit for volunteers. We're on various radio stations every month. And most recently this year, we've been on Channel 7. I hope that you've been watching us on the Sunrise Show and on the news show promoting our services. And oftentimes we will talk about our need for volunteers. I think, was anyone on asking for volunteers this year yet?
Yes.
Okay. Yes. Okay. So we do promote in all of our literature and our choices that we need volunteers. We need volunteers for Meals on Wheels deliveries, to work in our kitchen. We need volunteers to help with serving meals at our congregate dining sites. We need volunteers to be in the office to help with data entry, paperwork, to help with our evidence-based prevention programs, teaching classes. So there are lots of opportunities. And if it's something that does not fit our organization that someone wants to do, we have many partner organizations that we can link people up to. But I'm not sure why the number is lower in Marathon County, but we do really work hard to recruit. So spread the word. We need volunteers.
Supervisor Miller.
Thank you, Mr. Chairman. Jeanette, we have a large TV viewing audience tonight.
Yes.
So do you want to tell everybody out there in TV land how we can find you? I know where you are, but a lot of people do not.
Sure. You can go to our website, www.adrc-cw.org, and check us out there. You can call us on the phone. I don't know our 1-800 toll-free number. Somebody say it out loud. Somebody scream it. So we have a toll-free number, so it doesn't matter where a person lives. They'll get them to the right office. Do you have it?
Is this working? Okay. So toll-free is 888-486-9545.
Mm-hmm. And here in Marathon County, we're located at 2600 Stewart Avenue, Suite 25. Very nice accommodations.
The 2510 restaurant.
So right next to 2510, we're the lighter colored building with rounded features tucked a little further back.
Exactly. Thank you.
Okay, Supervisor Gumbs.
Well, I just have to disagree a little bit because I drove in on Highway 29 and my side roads are smoother than that thing is.
Okay.
So it's hard to feel too sorry.
Okay. Anyone else?
Christy?
I've got the tax levy amounts. So the total is the 858. I'll put glass. 181. Of that, in the original agreement, there was a percentage-based amount that was allocated to each of the counties. And in the case of Marathon County, we are 46% of that amount. And the contribution tax levy from Marathon County, that's been the same for years, is $395,367. And the percentage allocations, I can tell you those real quick. Marathon County is at 46%. Wood is at 23, Lincoln is at 17, and Lang County is at 13% of that amount.
Okay, thank you. Any other questions for Janae? Well, thank you, Janae. Thank you for all of your staff and all of your hard work in providing the services to our aging and disability community. It is invaluable.
Thank you. And thank you for giving us time on your agenda.
Next we have Supervisor Robinson and Joan Toyer in discussing the role of the Board of Health. I ate mine. It was.
So, first of all, we thank you for the supervisors that followed through. Who has their apple? This was part of the presentation. Others ate them, trying to be healthy. It's my honor to be here tonight as the President of the Board of Health to give you an overview of what we do and how we work in the community, and a little bit about who we are, because later in the agenda, you'll be asked to modify our bylaws or our structure and how we can make appointments. And it's always important for you to have some context to those discussions.
So, thank you for the opportunity to be here with John. And I want to invite you from this day forward to see Marathon County Health Department as the apple, reminding you that your health department is keeping you, your family, and community healthy and safe, thereby keeping the... Okay. Fun fact. If you were born in 1900, your life expectancy was 48 years. That compares to somebody who was born in 2000, life expectancy is 78 years of age. When asked what contributed to those 30 additional years, most people think it's due to what? Okay, healthcare, improvement of medical services. Healthcare contributed 5 out of the 30 years. So now you're probably curious, what contributed to the other 25 years? It was public health. Public health interventions such as vaccinations, motor vehicle safety, things like car seats for infants and small children, control of infectious diseases for things like smallpox. You heard about polio, TB, and measles. Healthier food and safer water. Healthier mothers and babies, recognizing tobacco use as a health hazard, to name a few. Marathon County is public health. Our health department is public health. It's part of a state and national network. As a health department, my charge as health officer and that of the Board of Health is to oversee the health of 135 residents, as well as those who work, learn, and visit our communities. And we do this by a number of things. We prevent infectious disease threats to the public by following up on diseases to control further spread, and we inform the public about ways they can do, what they can do to protect themselves. Anybody following the measles outbreak, there's a lot of public education about the benefit of vaccinations. We prevent unsafe food and water. We go out to licensed food operators and work with them, educate with them to make sure that the food you eat is safe. Likewise, a little fact that not very many people know, we also test private as well as public drinking water to assure that people don't get sick from drinking water. We promote strong, healthy families during the early years by helping families to have babies born healthy, teaching people, parents, how to be good parents, helping families connect to community resources, and prevent childhood trauma and injuries. We create places where it's easy to support healthy lifestyle by choosing to use alcohol and drugs safely, breathing smoke-free air, being active, getting healthy, affordable food, and most recently, making good mental health as important as good physical health. We protect against human health hazards, keeping the public informed of hazards and what they can do, protecting the public from hazards from things like radon, and making sure children are not exposed to lead. And lastly, we monitor and address community health priorities. We love data, and we are looking at data constantly to determine what is the major causes of diseases, injury, and premature death. And part of that process then is to facilitate community conversations and community partnerships to address those major issues impacting our communities. John's now going to talk a bit about why does a Board of Health exist.
The Board of Health, like the county board, derives its authority from the state statutes. In this case, it's Chapter 251 of the statutes, and we're regulated by the rules developed by the Department of Health Services. And much of the activity is driven by grants that are either passed through the federal government or state government onto us. But in the context of our authority really drives, or the seed for our authority that produces the apple is through the state legislature. And they saw the need to have a comprehensive approach to community-wide problems. And if you've got a case of measles in Antigo, it is likely to affect Wausau or Marshfield or Merrill or Colby and others. And there's a need to have a comprehensive, unified system of coordinating those activities across the state, because diseases and problems don't know geographic boundaries or don't respect them. So it was important for the development of a strong local public health department. And unfortunately, while the state has that as a goal, as a state, we're near the bottom, if not on the bottom, in terms of state support for public health funding. So there's a dichotomy there, if you will. So why do we do what we do? Well, we are responsible for meeting the statutory charge. Within the administrative rules and the statutes, there are different levels of service. We're at the top level in terms of level 3 for providing services to our residents, but we're trying to oversee the public health, expanding that 25 years of growth in lifestyles and make it a quality place to learn, live, work, and play. We rely on the input from our staff, the community partners, and others. And Joan's going to talk a little bit about who we are.
Okay. State statute requires individuals on the Board of Health reflect the diversity of the community and have a demonstrated interest or competency in the field of public health. There is to be no more than 9 members. They actually dictate that, as well as at least 3 shall be persons who are not elected officials or employees of the governing body. Members are appointed by County Administrator Brad Carter and then confirmed by Marathon County Boards of Supervisors. Just in terms of who's currently on our board and what their background, what value do they give and bring to the health department. We have 3 county board supervisors. John Robinson is our chair, and he has a background working for the Department of Natural Resources and has that lens, as well as his former work as a legislator. We have Sandy Sinclair, who is our vice chair and a background in agriculture that she readily brings to the table in our conversations. And we have Mary Ann Crosby, a retired teacher. In terms of our citizen members, we currently have 5. Lori Shepard, who is a pediatrician, a master's in public health, and a longstanding board of our health. And she really brings continuity. There's many times when we have conversations and she'll say, well, back in 15, 20 years ago, we talked about this. And it's really helpful in terms of having that lens. We have Ku Her, who's a registered nurse, also master's in public health. You're going to see a theme here in terms of people's educational background. And she actually works for a managed care organization and does case management. So she brings that lens, as well as she serves on North Central Healthcare's Quality Committee. Dean Danner recently retired as the Chief Operating Officer at Aspirus Clinics and has a background in public health when he worked down in Illinois. And our last 2 members is Michael McGrath, again, medical officer at Aspirus. He's got a background in occupational health, environmental health, family medicine, as well as a master's in public health. We're fortunate to have his expertise around the table. And Laura Scadori, who you probably have met and seen, is currently with North Central Healthcare as the Human Services Operations Executive, and prior to that was the Director of Bridge Community Health Clinic. I'm very fortunate to have a number of people who have not only educational background in public health, but also bring a wealth of experience when we are sitting around talking about policy discussions. So John's now going to talk about what the board does and give you some examples.
Again, we're regulated by both the state statutes and the administrative rules in what we can do and the policies that we can enact. We can enact things up to the state level, but not in many cases beyond where our authority is. And we try to make sure that we're meeting the requirements of the that the state imposes on us, the grant commitments and others. We will look at and periodically update ordinances and policies and that govern environmental health, inspections, and we will on an annual basis review our fees relative to the retail, our licensing activities to try to recoup our cost in those. We work to assess public health needs and advocate for the provision of services. That includes our working with our partners in the community. We'll talk about that a little bit later. And then we'll develop policy and recommendations in terms of leadership and how we can meet the public health needs of the community. One of the strengths of our department, and particularly when you start talking to others, is that we do a very good job of collaborating with other partners. Those partners include Marshfield Clinic, Aspirus, Ministry, Bridge Clinic, and other healthcare providers in terms of who we serve, how we coordinate services, maximizing the public resources as well as coordinating with the private resources to make sure that we've got a better plan, working with United Way and the Life Reports and others. But in terms of in Marathon County specifically, we deal with adopting regulations for human health hazards. We've spent time talking about mold and lead and a number of other things that pose threats to children or vulnerable populations. Regulation of body arts. Staff have been involved in trying to educate the community in context of vaping and some of the hazards associated with that. We've worked with our partners in developing that comprehensive community plan every 4 years and updating that. We periodically host educational meetings both for the community and public officials, meeting with legislators periodically to talk about issues of concern. And we'll look at the effectiveness of our programs. We spent some time earlier this year looking at the lab and how is the lab operating, how are the fees generating, are there some better ways we can do that? We've done that with our sexually transmitted disease, HIV program, and also reviewed the Start Right program as well as others. And on an ongoing basis, the board members bring their expertise in that. And we will try to represent diverse perspectives of residents in our meetings, as well as looking at things like environmental justice and health equities. And we know that the more you are educated, the more you earn, the more likely you are to be healthier. We can't control that as a Board of Health, but there are other factors that we can work with the community to try to deal with. Working with plainclothes individuals in the western part of the county with the immunization and some of the concerns, and trying to adopt policies with that or orientated toward helping them. And finally, we will work closely with Joan and her department, and she's got an outstanding staff that works well and tirelessly to serve the county.
So the policy decision that's before you is we had a board member step down recently, and it gave us the opportunity to take a look at what the current ordinance is as well as our own bylaws. And in reviewing that, I was reinforced the fact that our current ordinance, Marathon County's ordinance, and our bylaws are more restrictive than what is required by the state. Our bylaws, adopted many years ago, felt that there was benefit in having a dentist and a veterinarian on staff. And in light of the shift that has occurred in public health, where we are really looking at the social determinants of health, which is basically the social and economic conditions that are impacting the health of our individuals, our families, and our communities. I see this, the Board of Health has seen this as an opportunity to take a look at broadening our current bylaws and the Marathon County Ordinance to be in keeping with the state statute. So our ask really is we want to broaden the diversity of our members in order to be in a better position to respond to today's challenges. That is what our charge is.
You know, years ago, rabies and other farm human animals to human diseases were much more concerned. But we have the silver tsunami that we referenced earlier, and the growth of the elderly population, changing demographics in terms of the different populations that are here, whether it's the plainclothes, the Hmong, Hispanic, or other groups that come here. We are also working more closely with groups like the Western Marathon County Healthy Communities Group to try to do that. But it requires rethinking who's on that board and what they bring.
So, in closing, the next time you see an apple, you are going to think of what? An apple.
The Marathon County's Health Department.
Marathon County's Health Department. Thank you.
Public Health Services. Any questions?
Any questions of the board?
Donna?
Please use the request to speak.
I would, no, it isn't. Oh, it is. Okay.
Supervisor Krause.
Yes, thank you. I noticed that you mentioned the diversity of the recipients that you serve in this area, Marathon County. And I was wondering if there could be some diversity allowed on your board, possibly. There are other kinds of medicine that have been excluded from acknowledgement and practice in this area, and there may not be as many trained in this area as there are in Green Bay or Milwaukee or Appleton or Madison. But there are people who are degreed and licensed by the state. But it doesn't seem that this type of medical alternative practice is considered probable and reliable and expert medical care. Even though the state licensed these people, like acupuncturists, naturopaths, chiropractors, I don't think aromatherapists, but there is also herbalists. And there are MDs that have these alternative health degrees also because they find them invaluable in helping their patients. Now, with so many problems with the flu vaccine, antibiotic resistance, the side effects from antibiotics that are dangerous, these things are dangerous to the population. Is there any thought, or could you possibly bring forward where there might be some diversity on your staff or on the board of practitioners who do alternative and are familiar with that type of treatment?
Yeah, I'll answer that. While we may have individuals who have medical director or medical doctor behind their names, I want to emphasize they are sitting there with their expertise looking at population health. They have masters in public health, so they see health much broader than maybe what they do for their day job, their clinical day job. So, and that's why I actually shared what people's educational background was. I am really fortunate to have a slate of board members with masters in public health. Masters in public health looks at health broadly, looks at alternatives to traditional medicine. So I am fortunate to have those voices sitting around the table.
Supervisor Christensen.
Thank you. First of all, I got two questions. What kind of apple was it, and how are you funded? Are you funded solely by the county, or does the state help out?
This is not a Macintosh, that much I know, because it's held up well for the last week. So anybody that's had a Macintosh, you know it because it's probably in pretty funky shape right now. In terms of funding, I think right now, don't quote me, but it's about 64% is tax levy. As John indicated, Wisconsin having robust state statutes to say this is what governmental public health is charged to do, ranks near the bottom. I think last time I looked, tied in last or second last place. So we are a state that believes in local rule and local funding for public health.
Supervisor Lowe.
Thank you. I'm really glad that Supervisor Robinson brought up environmental justice and in the policy decision. I'm really glad that in there I see social and economic issues. So I was wondering if you could speak more to these social and economic issues. Can you give us a few examples of what you're working on?
I can.
Once you start.
I'll start. When we talk about health of the communities, I don't know how many people here have seen or read about the county health rankings that comes out once a year. That model says that 40% of the health of the community and those living in it is due to social and economic. So when we talk about social and economic, we're talking about things like educational level. We're talking about things like housing, income, social connections. And it's an area I would have to say is relatively new in public health, like in the last decade. And so it's something we're very aware of when we're providing services or setting policy. I think in the coming years, we would like to see ourselves more involved in sitting around more tables that are addressing those issues. But just to give you an example, many of you probably were tracking the story about the mobile home park on Grand Avenue. We licensed that, as well as the city of Schofield. And when they had their hearing, our two colleagues who were part of that hearing came back to the health department and talked to me about how it went. And our first action was, well, we need to assemble some community resources and help residents understand what choices they have in the event they do have to leave the mobile home park. So that's an example of how we think beyond just the services we are delivering.
Okay, and then my second question.
If I could add to that.
Oh, sure, go ahead.
Recently, the department adopted a strategic plan. And as part of that, we try to incorporate some of those thoughts into it with the expectation that staff work on those justice issues and, but some of the ways that they deal with that is, the plain clothes issue in immunization, and it poses a potential threat from the fact that they have not been heavily immunized as communities. And when you get into Western Marathon County, there's a significant concentration. So staff have worked closely with the bishops and the religious leaders to try to go out and educate them and try to break down some of the barriers and concerns relative to the justification for having measles. And they'll do that with other communities when we've had some issues with TB in certain communities. So we'll drill down and work with them, and they have worked to support the local foods initiative and safe schools, safe way to schools, and the bike pad plans and other things. The environmental staff is involved in the Thomas Street discussion and providing. Dale Grosskopf and company is heavily involved in those and trying to deal with and walk through the myriad of environmental and health issues that relate to the citizens in those neighborhoods.
Great. Then my last question is, are there some areas that you see that are lacking in Marathon County that could be improved upon?
Yes. Yes. It's like, yes. I think the struggle we face and I don't want to understate what Jeanette said. When you think about the charge, 135 residents and people who come here to learn, work, and visit, we're responsible for their health. We have a staff of 41. So it's a big charge, and we have to honor what is statutory required. We are fortunate in, I've shared this story before, so some of you have heard it. The reason I'm sitting in the seat sitting in as health officer for Marathon County is because of the value of partnerships here. I've worked in many communities across Wisconsin in very different roles. And I would say there was a handful of communities I thought if I was going to be a health officer, that's the community I would want to work in. And the reason why that's so important is we couldn't do what we do without partnerships. And we're fortunate that people get the value of partnerships and put staff resources and money to further our work. So I know I'm being evasive, but to me that's kind of a loaded question. And I'm like, what area would you like me to tell you about where I would like a magic wand with some resources everywhere?
I think one of those areas that we've identified and we've made some innovative attempts to try to deal with it is the issue of behavioral health as it relates to trying to support activities within the schools. But we're only serving 5% of the county's population in the need, and there's the other 95%. The results have been good. Last Thursday, you received a copy of the annual report. I would encourage you to look at that. If you have questions, please let us know. But behavioral health, mental health services, and that support is so critical to the integration of health delivery, the delivery of health services, and we just don't have enough providers. We just don't have the adequate reimbursement mechanisms. So we're looking at ways to try to expand opportunities within the limited resources that we have, but that's a critical need.
Supervisor Schaefer.
Thank you, Mr. Chair, but Mr. Robinson answered my question earlier. Thanks.
All right. Any other questions? If not, thank you. Thank you, Supervisor Robinson, and thank you, Joan, for all the work that you do on behalf of the citizens. I'm moving on to item number C, consent agenda, item 9 through item 13A-B. What is your pleasure? Motion by Supervisor Langenhahn and second by Supervisor Gums. Any discussion on the consent agenda items? Again, C9 through C13A-B. Any discussion? Seeing none, we will proceed to vote. And we will proceed, and the motion is carried unanimously. Moving on to item D, ordinances. Number 14, amending section 2.05, parent 1, parent D, General Code of Ordinances to provide the Board of Health membership to track statutory language, ordinance 0-8-19. Motion by Supervisor Schaefer and second by Supervisor Robinson. Any discussion on that agenda item? Any discussion? Okay, seeing none, we will proceed to vote. Supervisor Zerini and Supervisor Boots, please confirm. And thank you. We will proceed, and the motion is carried unanimously. Moving on to resolutions. Item E, Human Resources, Finance and Property Committee, item 15, approving 2019 interdepartmental budget transfers for Marathon County Department of Appropriations, Resolution 31-19. This does require a 2/3 majority vote of the board. Supervisor Stark with the motion and Supervisor Durham with the second. Any discussion on this agenda item? Any discussion? Seeing none, we'll proceed to vote. And we will proceed. And the motion is carried unanimously. From Extension, Education, and Economic Development Committee and the Diversity Affairs Committee, item number F16, declaring June as Pride Month for Marathon County, Resolution 33-19. Supervisor Rosenberg with the motion and Supervisor Johnson with the second. Is there any discussion? Supervisor Boots with Supervisor Boots.
I'd like to offer I would like to offer a substitute resolution R3319 on behalf of the board chair. I've read the original resolution as well as the substitute resolution very carefully. I personally feel with some input from the board members passionate about the original resolution and some give from some of the board members not so passionate about the original resolution, we as a county board can mold this new resolution into something we can all agree to stand behind. Thank you.
Is there a second? Second by Supervisor Fifrick. Any discussion? But before we go on to discussion, I would like to briefly explain. First, let me explain why I worked on this draft substitute resolution. But before that, I want to take and thank a few people and groups who have worked on this issue to date. First, I want to thank the Diversity Affairs Committee. Second, I want to thank the Extension, Education, Economic Development Committee. Third, I want to thank all the citizens of Marathon County that spoke to this board last Thursday. I want to thank all the residents that have contacted me and all members of this board by email, by phone, by letter to express their opinions. I also want to thank this board for the respectful discussion that it had last Thursday. I want to thank the administrator, Carter, and the Deputy Administrator Leonard. Last Thursday, I listened intently to all speakers of this board and this board's discussion. I have heard from citizens of Marathon County. One takeaway from everyone is that the passion that they spoke and feel. This is a meaningful issue. There was one point that I felt uncomfortable with the discussion. There was some personal attacks on some of the members of the board. Here again, had I done a better job of controlling and requiring respectful discussion, that would not have happened. And for that, I apologize to those board members. Everyone must understand that we are part-time legislators, and we do not have professional speech writers. We're all trying to do our best. One member used a poor example in his remarks. He made a mistake. If anyone takes the time to know this individual, they would clearly see that this person has nothing but respect for everyone and all mankind. He is devoted to serving our community. He volunteers throughout the year and every day during the fair to help youth in this community. He works tirelessly to make this a better community. We all make mistakes. At times, we all misspeak. But we all must endeavor to keep talking, and more importantly, we all must keep listening. While attending the department head meeting on Friday, June 21st, it was stated that perhaps this board is not ready for this discussion at this time. During the committee board meetings, I heard discussion among supervisors that what is acceptable to get this resolution passed? Should it be 1 day? Should it be 1 month? Should we pass the original resolution to show support for the LGBTQ plus community? Others objected on moral reasons, while many on both sides question whether any resolution would change one person's bias or prejudice. The reality is that passing a resolution that does not educate or engage the public in changing how we interact with our fellow human beings falls short of the intended outcome. Are we so invested politically that we lose sight of the goal? Social progress? We're better than that. We all desire the same thing, to make Marathon County a better place because we serve our community. A resolution of merely words with no call for action is hollow, and passing nothing is completely unacceptable. We must do better. Our actions will speak louder than any resolution this board ever passes. Our actions will demonstrate that open and inclusive community we all want. After some long thought and reflection, what is being missed? The board has lost sight of the tool that we have in our board rules, that of public engagement, a tool that we can use to assess the policies, practices in our governance role, a tool that we can use to ensure that the policies treat all people fairly and with respect. It is with these goals in mind that I've decided to create the substitute resolution. The substitute resolution provides a clear direction to staff to take up a review of the policies and practices. It provides a timeline for education and public engagement. And importantly, it calls for continued discussion and growth. In the end, this substitution resolution will move us closer to being an open and inviting community that we all strive to achieve. I encourage my colleagues to support this resolution. Thank you for your respectful discussion, and thank you for listening.
Point of order. I don't believe that the substitute resolution and the ruling on this is actually a substitute. I don't believe it's really germane to the initial resolution. It's a resolution, no doubt, but it doesn't seem to be an adequate substitute for 33-19. And so I'd like a ruling from Court of Counsel on whether or not that chair. Or the chair.
The ruling will come from the chair, and I will confer with counsel. I will invite the Corp Counsel to address the question at hand.
Sure, and thank you for asking, because I spent some time working on this, because I really did think that this was going to be an important question. And so what Robert says about this is, it says an amendment must be germane in order for it to be in order. To be germane, an amendment must in some way involve the same question that is raised by the motion to which it is applied. So the resolution that the main question, the main resolution came from the Diversity and Education and Economic Development Committee. Essentially what it says is that it recognizes our core value, it recognizes the need for diversity, and what it says is that as an expression of Marathon County's commitment, we name the month of June Pride Month in recognition of the diversity of the LGBTQ plus community. I think that this substitute resolution in some way involves the same question. I believe it is a very broad definition, but I believe it meets that definition. Well, he needs to make the ruling first, and then.
Sorry. I will rule that the substitute resolution is germane, and so that is the chair's ruling. Okay. The supervisor has appealed that ruling, and I will have Corp Counsel explain the next.
Speak to it on the reason for appeal?
You do, and the chair does not then get to respond with regard to the appeal, but other people do get to talk about the appeal, and then it's a majority vote. It doesn't require a second.
Thank you. The reason I'm appealing this substitute resolution is the main thrust of the initial resolution is to designate June as Pride Month because of the community of folks who have been marginalized. They're not even mentioned by title in the substitute resolution. They don't come up. There's a lot of very broad language encompassing everyone, encompassing everything. Now, in no other resolution, last month we had 2 resolutions before this body. And one was designating Hmong veterans. The other was Indigenous people. Nobody said, these are too specific. Nobody said, this isn't inclusive enough. Nobody said we need to broaden this. Now, everybody knows what's behind this, that people are uncomfortable saying that, well, we don't want to recognize those folks. But quite honestly, we all know that's what it is. We don't have to talk in code. Let's be adults. Let's talk about what it really is. And the fact that this substitute, quote unquote, substitute resolution is so broadly written, it could apply to anything. And in fact, it lists just about everything in it, but does not really focus on the core issue of Pride Month. Pride Month is nothing new. It is nothing that is coming to being in Marathon County. It exists everywhere. The state of Wisconsin passed it last week. The Republican legislature passed it on a voice vote. Pride Month. It's not a controversial thing, but it's an important thing. And as to this specific issue of the resolution being an adequate substitute or even being related, I guess they're related like a raisin and a pineapple are related. But that's about as close as it gets. I mean, it really does not address the core issue, which is the designation of Pride Month. You know, the substitute resolution, while well-meaning, I don't doubt the chair's positive approach towards this. However, it falls so far short of the mark that it's not adequate, that it is not comparable, that it should not be considered a substitute. And I didn't invite anyone else to speak on this issue. Thank you, Mr. Chair.
Supervisor Lowe.
Actually, I don't have anything to say about the substitute, but I have a constituent that would like to speak on the original.
Not
that
on,
could be like-
not on the appeal, not on the
No,
appeal.
not on the appeal,
That's
on
a
the
point of
original.
order right now.
Yeah.
Okay, is there anyone, the Supervisor Rosenberg?
I was looking to speak on something else.
Okay. Supervisor Leahy?
I too had a constituent that would like some time and wanted to speak on the original resolution.
Okay, we are right now talking about the chair's ruling that the substitute resolution is germane to the issue. Is there any further discussion? Supervisor Zhang.
Mr. Chair, can you clarify the votes? The motions. Is an aye for agreeing with the chair's?
When we get to voting, I will. But at this point, I'm looking for anyone who wishes to discuss Supervisor Johnson's appeal of the chair's ruling that the substitute resolution is germane to the topic. And we have Supervisor Krause.
Yes, I would like to speak to the ending of the substitute resolution, be it further resolved.
We're talking about whether or not the chair's ruling is and the substitute resolution is germane to the original resolution. That's what we're discussing. Supervisor Boots.
Thank you, Mr. Chair. I guess I'd like to hear what would like to be added. I mean, that's kind of what I was saying when I put this forward. I'd like to know what would be added to this document, because we can always add to this document amendments. So I guess I'm not understanding why we can't add to a document. That's what I can't really direct it the question where I'd want, but I guess, I mean, I'm all for adding amendments to that, and that's kind of what I was getting at when I said my things after the substitute resolution.
Robert's rules say that we're going to be voting because the individual, the supervisor has appealed the chair's ruling that the substitute is germane, and so we will, at a future point when no additional request to speak has been honored, we will proceed to a vote as to whether the substitute resolution is germane. If that is upheld, then we're back to where we were with the substitute resolution. Supervisor Leahy.
I would like to nominate a constituent, Patrick Barker, to talk about the specific issue of whether or not it's germane. Is that allowed?
Is there any objection by the board to have a resident or a constituent speak to this board about the germaneness and the board chair's ruling on the, there is objection, okay? Now we will take a vote on the Okay, we are going to take a vote as to whether or not to allow the citizen to speak to the germaneness ruling. But the question before the body is, do you wish to allow the resident to address this board on the question that is before this board? And there's no further debate. So we will proceed to the question, and I will allow the individual to speak to the germaneness question. No will bring us back to the discussion of the germaneness. So an I will allow the individual to speak. A no will put us back at the point of discussing the germaneness and the chair's ruling. And we will proceed. And the board, that motion has failed. And so we are back discussing any further discussion on the chair's ruling that the substitute resolution is germane to the original resolution. Any further discussion? Supervisor Lowe.
Thank you, Chair Gibbs. I respectfully disagree that the substitute resolution is germane to the original. This substitute resolution really groups everyone into one group. I am not an Indigenous person, nor am I LGBTQ. I think everyone has their own special issues that make them who they are, that makes a group who they are. To group everyone into one big group, I mean, that really broad paints every group in every different group, every marginalized group in Marathon County. I think it's unfair. We're not paying attention to, these special groups' issues and discrimination in Marathon County. And so I respectfully disagree with the substitute resolution. Thank you.
Vice Chair McEwen.
Thank you, Mr. Chair. Looking at the original resolution, like I spoke last Thursday, I agree with 80%, over 80% of the original resolution. What I had an issue with was not being inclusive. We were being inclusive, we were being exclusive. And what I mean by that is, if I believe the LGBTQ plus is a minority and they're being discriminated against, I do believe that all the other minorities which are listed in this substitute resolution are being treated the same way. And I don't believe that anybody should be discriminated against. I believe everyone should be treated equally. And I can't understand why somebody would have an issue with this resolution, because we are including the LGBTQ in this resolution, not specific.
Please, we will have decorum in this room, in the courtroom.
And what I mean by that is, if you believe that the LGBTQ is a minority, they're in this resolution. Okay, I'm not excluding them from this resolution. So I think it is germane to this whole issue. And many of the constituents, I received a lot more emails over the weekend that asking me to vote yes on this. However, the ones that I did talk to personally also, number one, had an issue with why we were excluding everybody else. Handicap, one lady, she has a handicapped adult son, and where is their month? And I said it was not the intent of this resolution to exclude anyone. I believe that. I believe everybody was supposed to should be represented equally. So I would urge you to vote for this resolution, because I do believe that it is germane to the issue that we were discussing. Thank you.
Supervisor Johnson.
Thank you, Chairman Gibbs. Vice Chair McEwen, I'm going through the substitute. Nowhere does.
First off, I would like to stop. I would stop. Any discussion will be directed at the chair. And we will not call out any supervisors by name, and we will keep this moving forward respectfully. And so, thank you.
Right. Okay. As I was about to say, there is nowhere in the substitute resolution where LGBTQ plus appears. Nowhere. It's not in there. So to say that it's included, that it's the same thing and it just broadens it, I have a very hard time accepting this because it changes the entire meaning of the resolution. The entire meaning. There is no reference in the substitute to the Stonewall riots, which kind of gave rise to this, to the struggles that the LGBTQ plus community has gone through. There's no mention of that. It's just a bunch of big, fuzzy, feel-good stuff about let's love everybody. Well, we should do that anyway. We don't need a resolution to do that. That's just common sense. We're addressing a specific issue, and that's why I don't think that this is germane, because it is so broad and so fuzzy and so unfocused that it loses what the initial resolution is. So I would urge my fellow supervisors to support the appeal, because this is not the same thing. If we want to pass this resolution, bring it up as a standalone, not as a substitute, because it does not substitute. It does not meet the content, Mr. Chair. It does not, and I hope other supervisors can see that, and we can vote on this other resolution at any time. Bring it up as a standalone, but not as a substitute. Thank you, Mr. Chair.
Supervisor Rosenberg.
Thank you, Mr. Chair. I would agree that this is not an appropriate substitution. Just based on our agenda and the way we've been messaging this resolution that we're talking about today, we're calling it June Pride Month. And that has a very specific definition. And when I look at this, we're not calling it Pride Month. We're calling it Diversity and Inclusiveness Month. So I guess that alone to me says that this is not the same thing.
Supervisor Seiler.
Thank you, Mr. Chair. Just a little history. September 17th, 1796, in his farewell address, George Washington penned the words, "Observe good faith and justice to all." March 4th, 1865, in his second inaugural address, Abraham Lincoln uttered his immortal words, "With malice toward none, with charity to all." Tonight, Chairperson Gibbs offers in the last paragraph of the substitute resolution the phrase, "Ensure that Marathon County lives up to its goal of being welcoming and inclusive to all people." Inclusive words with the emphasis on the word all, mirroring the intent and wisdom of historic leaders striving to create a just and harmonious society. Therefore, I feel this substitute is worthy of our support. Thank you.
And I was inaccurate when I said the appeal does not need a second. Is there a second to the appeal? And Supervisor Lang is the second to the appeal. Thank you for that clarity. And we will move to Supervisor Lowe.
Thank you, Mr. Chair. I just want to add that the substitute resolution is not germane to the original because the original went through 2 committees, and this resolution did not. It went through the proper channels. It went through Diversity Committee, and then it went through EEED Committee. So this substitute resolution did not go through the proper channels. So I see that as not germane to the original. Thank you.
Supervisor Schaefer.
Thank you, Mr. Chairman. I call for the question.
Is there any objection to the question being called on the appeal question? Okay, no objection. So question's been called. We will proceed to vote, and I will explain so everyone is clear what the vote is. An aye vote upholds the chair's ruling that the substitute is germane. A no sustains the appeal, and the chair is overridden. Again, an aye sustains the chair's ruling. A no overrides and overrules the chair. So we will proceed to vote. And we will proceed. And the ayes have it. The chair's ruling is upheld. The substitute resolution is germane. Now we move on to discussion of the substitute resolution. Any discussion? Okay, any discussion on the substitute resolution? Supervisor Johnson?
Thank you, Mr. Chairman. Since we've had a bit of a history lesson, I'd like to continue along that vein. A little less than 100 years ago, community leaders in Marathon County and the city of Wausau were faced with an offer and faced with a decision. They were offered a 4-year university to be sited in this county, and they declined. They declined because it didn't fit what their vision of the way of life in Marathon County and the city of Wausau should be. They declined that offer, and so UW Stevens Point was born. In retrospect, that looks like a pretty bad decision. Stevens Point has grown exponentially from the little town that it was at the time of the university. Their incomes have gone up. They're innovative. Their level of education in the community, their level of diversity is much higher than ours. Because our city fathers, almost 100 years ago, decided they didn't want those kind of folks here. They didn't want those troublemaking kids here, causing trouble. Now, the decision before us on this, on the Pride resolution, may not have the same scope and same depth of impact. It may, though. 50, 60 years from now, it may have that same level of impact. But it is in the same vein that some folks, some of our constituents, and we've all had emails, some of our constituents have said, essentially, we don't want that here. We don't want that designation here. This troubles me greatly because we're here to set the tone, to be inclusive, to be welcoming. And the very folks we're trying to attract to this community, young professionals aged 18 to 34, 18 to 40, that we're trying to attract, their attitudes are different than those emails we received against it. Their attitudes, and I sent out a study to every board member this afternoon of 18 to 34-year-olds' attitudes towards the LGBTQ plus community. And they're vastly different than the negative emails we received. And I really fear that if we do not, if we pass the substitute rather than the original resolution, that we're going to lose a whole bunch of folks that will not even consider coming to this county. Because we've already given ourselves, quite frankly, we put ourselves on the map in a negative light already. This should have been a no-brainer to pass. It should not have been controversial. No other body is having this kind of trouble with this issue. But do we want to be the folks that almost 100 years from now, they look back and say, you know, Marathon County could have really grown. They really could have done well had they not been so divisive. Because in this attempt to become inclusive, it's become more divisive. And it's drawn more and more negative attention to the attitudes that are unwelcoming, uncaring, and quite frankly, some of them are bigoted against this community. And that's why that resolution designating it as Pride Month is needed. Not Inclusive Month, not Everybody's Wonderful Month, Pride Month. Because it says a specific thing that needs to be saying at this point in time. So I hope that my fellow supervisors will consider voting down the substitute resolution because it's not adequate. It doesn't do what the initial intended. It's going to harm this county in the long run. And none of us want to see that. So I truly hope that we can get back to the original resolution, pass it, and get moving this county forward. I'd really love to see that. Thank you, Mr. Chair.
Supervisor Leahy.
Thank you, sorry. I too worry that the intent of the original resolution has been lost, that in trying to recognize everyone, we've lost the meaning of recognizing this particular group of persecuted and marginalized people. That being said, I'm also disappointed, I guess, that these questions or issues with a lack of directive purpose weren't exactly brought up in a very real way in the last discussion. I know there has been kind of comments about, well, what does this really do? This won't do anything, things of that nature. I guess I question, and perhaps this is more directed at Mr. Corbett, perhaps this is too late. Would it have made more sense? Is it still possible to take a look at the original resolution and add on these directives added to the substitute to make, I guess, to boost that original resolution in a more meaningful way with education directives for the board, employees, and even the public?
I'll allow the chair, or the Corp Counsel to answer the direct question.
Couple of options. You can still offer amendments to this substitute amendment. So if you want to change something about that, that is also subject to the will of the board. Also, if you vote down the substitute amendment, what will happen is it will revert back to the original main motion. And amendments can be offered to that as well. So,
okay, Supervisor Rosenberg.
Thank you, Mr. Chair. And thanks for the work you've done on this. Really, this substitute in a different environment, I would really be all about this. This has some great stuff. I mean, a lot of it comes straight from the Pride Month resolution. What bothers me is that we're no longer voting on Pride Month. And I guess I have a question for Mr. Corbett. If we were to move this substitute amendment, recommend it goes to the Diversity Affairs Commission, is it all over for this whole vote, or do we still get to vote on Pride Month?
If a motion were made to refer back to committee, that is a motion that is fourth and proprietary motion, and so that would refer the current substitute resolution back to the Diversity Affairs Committee, if the board were to approve that motion.
Well, it would move it. Her question is, does it move the whole thing back? And the answer is yes, it would move the whole thing back.
Let me correct that. It would move not only the substitute resolution, but the original resolution also would be referred back to the committee.
Thank you, Mr. Chair. I guess I just want to share a couple more comments on things that I've heard from the community since we've started this discussion about 3 weeks ago. I've heard from people who are in the LGBTQ+ community, and they've told me that they're afraid that they'll lose their jobs. They have lost their jobs. They have been cussed out on their wedding day in front of the church. They have, they're harassed, they're assaulted, they're afraid of being assaulted. And I guess when we're talking about Pride Month, we're talking about standing with our neighbors, our sisters, our brothers. And that's why I think it's so important that we take a clean vote on this. I understand that we want to get along. There's so much good in this resolution that you have before us. I wish that we could have, started talking about this maybe strategically with the Diversity Affairs Commission overall. It would be great to start seeing some of this stuff. It would be great to start having some of this language, especially when it comes to the public dialogue. I've had so many offensive conversations from people, well-meaning people, who don't even know they're being offensive. So clearly we have some work to do. I'm still thinking about that motion, but I'm going to wait a second.
Supervisor Miller.
Thank you, Mr. Chair. I'm a little confused what exactly is allowed by this resolution that the law already does not allow? In other words, if it were not to pass, could any group still go out and have a parade or a demonstration if they had the proper permits? It really doesn't change anything. The law says that they can still do these types of things. Groups and organizations can be recognized. So in effect, it's like somebody said, it's a feel-good thing, but it doesn't change anything. Doesn't it change the law?
Supervisor Lang.
Thank you, Mr. Chair. This may be a surprise, but I agree with something Supervisor Miller said last week. He mentioned that this is the craziest thing he's ever seen. I couldn't agree more. This has gotten crazy. I think it's crazy that in the same breath, opponents of this resolution argued that even though this followed the same process as any other resolution, starting at the committee level, that this was somehow rushed through without proper notice or allowing public input. And then turning around and offering an amended resolution 4 hours before the meeting with no public hearing. I apologize to the constituent who wanted to speak, and the board did not allow you to speak. Something that I do believe changes the entire purpose and spirit of the proclamation. I think it's crazy. We should have to tell people that a marginalized group making up 3.8% of our population, which by the way is a pretty conservative estimate, is too small or insignificant compared to the whole. We have to ask, where was the level of outrage from constituents and other supervisors when we are asking to recognize our county's Asian population, which is 6%. The Hispanic or Latino population, 2.8%. People who identify as 2 or more races, 1.6%. African American, 0.9%. And American Indian, 0.6%. When you actually look at the makeup of our county, 3.8% doesn't seem that small. And we shouldn't have to remind you that when you fall into the demographic that makes up the other 91% of the county's population, you don't always get to decide what too small means. And mostly, I think it's crazy that we are so desperate to not recognize the LGBTQ community and find any excuse to see this resolution fail and diminish that community, that we have come up with a list of excuses that don't make sense. We've reduced human beings to dollar signs attached to bathrooms, or the difference between number of days on a calendar, or the word choices in a resolution. It's crazy that the LGBTQ community is being blamed here for causing controversy and creating divisiveness. The controversy here is caused by the opposition to something positive, and it's unnecessarily polarizing. It's caused by telling one group, we don't see you, but we see all marginalized groups as the same. And what's worse is this controversy is just one dot on the radar of a society that's always looking for the next thing to be outraged over. So regardless of the outcome tonight, this will most likely be forgotten when the next controversy comes along, but there are people in this community who will not forget the message we sent with our vote. Like a lot of other supervisors, I've had some really great conversations in the last few weeks, and I've had some really difficult ones. It's definitely not easy to have uncomfortable conversations, and a lot of us struggle to have productive dialogue with people who are inherently different from us, have conflicting values, or don't agree with our choices. I tried my best to learn as much as I could about my own constituents, especially other community members who were opposed to this resolution, and at the end of the day, I feel like I'm able to defend my stance on this issue. I want to ask everyone in this room to think about your vote tonight and ask you to imagine going over there where I recognize many members of our LGBTQ plus community and their allies and defending your vote to them. What would you say to them, to their faces? How would you tell them that you don't believe they deserve to be recognized? And I urge you to do the right thing tonight. Vote for the resolution as originally written. Do not vote for the substitute resolution. Thank you.
We will have decorum. We will have decorum. Please. Supervisor Boots.
I withdraw my request to speak. I withdraw my request to speak.
All right. Supervisor Miller.
I'll pass.
Any further discussion on the Supervisor Bovee?
Thank you, Mr. Chair, and I just want to say that I'm somewhat disappointed tonight. I'm disappointed that the chair didn't recognize that this would be an issue when this first came to committee. Certainly you had to see that this was going to raise a lot of fuss in the county, and it certainly has. And I would like to see the substitute resolution turned down, and let's go back to the original one and see how it goes. Thank you.
Okay, any further discussion on the substitute resolution and the motion to approve? Any further discussion? Any further discussion? Seeing none, we will proceed to vote. An aye vote approves the substitute resolution. A no vote will defeat the substitute resolution and move us back to the original motion to approve the original resolution. But just to be clear, irregardless if this passes first here, there is a second vote that is required on if the substitute motion or substitute resolution is approved by this board, then that takes place as the motion, and then the board has to vote a second time. Okay. Everybody clear on what we're voting on? Voting on an aye to approve the substitute resolution. A no defeats the substitute motion. We'll proceed to vote. And we will proceed. And the motion is defeated. And now we are back to the original resolution as presented, declaring June as Pride Month in Marathon County. Any discussion? Supervisor Miller.
Mr. Chairman, I'd like to amend that motion to request that this resolution be approved annually by a majority vote of the board.
Is there a second? Is there a second? The motion is to require an annual vote of the board. Is there a second? Supervisor Schaefer with the second. Is there any discussion? Supervisor Johnson.
Thank you, Mr. Chair. If anything points out that there is a bias towards this particular group, I would think it would be making a motion that it's saying that it had to be authorized every year, unlike any other resolution we've ever passed. So I think it kind of points out that there's something different about this, and I would urge people not to vote for this amendment. It's just foolish. It doesn't keep with precedent.
We will have some decorum. We will not attack anybody's view, anybody's opinion, anybody's view on any issue, please.
With all due respect, Mr. Chair, if an idea is foolish, I'm going to call it foolish. Thank you.
Is there any further discussion? There is a motion on the floor. Supervisor Schaefer.
Thank you, Mr. Chairman. This is a democracy. When someone makes a motion, it's pretty nice if somebody will second it. If I don't like it, I'm going to vote no, but I think it deserves a vote.
The other thing is a proclamation, is required every year for in a lot of cases in proclamations. And I'm not saying in favor or opposed. So any further discussion? Any further discussion? The motion to amend is to require a vote by this board every year to annually recognize that day. Any further discussion? Seeing none, we'll proceed to vote. An aye vote will require that this be required to be brought back to this board for voting every year. And we will proceed. And the motion is defeated. And we're back to discussion on the original motion. Supervisor Rosenberg.
I would like to offer an amendment, and I'm wondering if I need to read the whole thing into the record or if I can just tell you what I'd like.
No, we need to have the whole thing read into the record, please.
In the substitute amendment, the last two, be it further resolved. Be it further resolved by the Marathon County Board of Supervisors that it will commit to educating itself on the plight and challenges faced by minority or marginalized groups to better develop truly inclusive public policies, services, and practices. Specifically, the county administrator is directed to support the board by arranging for regular educational sessions beginning in September of 2019 and concluding in June of 2020, intended to develop a common understanding of the terminology for discussing the status of minority and marginalized groups, b an accurate understanding of the history of minority and marginalized groups in Marathon County, and c a solid understanding of the dynamics of implicit and explicit bias and institutional and structural discrimination that can lead to health disparities and other outcomes that are inconsistent with our commitment to diversity and inclusion and our goal of being the healthiest, safest, and most prosperous county in Wisconsin. And be it further resolved by the Marathon County Board of Supervisors that it will commit to utilizing the public engagement methodology to discuss how specific county government policies and practices can be changed or updated to ensure that Marathon County lives up to its goal of being welcoming and inclusive to all people. The public engagement process will start shortly after the educational sessions are completed, but not later than September of 2020.
Supervisor Johnson with the second. Any discussion on the amendment and the motion to amend to include the last two, be it further resolved, that was published in and on the substitute resolution? Supervisor Lang.
Thank you, Mr. Chair. I do want to tell you that I appreciate the work that you put into the substitute resolution, and I do agree with Supervisor Rosenberg. I think, as a standalone resolution, it's great, and I think some of the aspects of it, when added to this, really add some substance to it, and so I agree with adding some of those parts to this. Thank you.
Supervisor Boots.
I have a question. When I would bring forth, I'd like to send it back to committee.
You can make that motion.
I would make that motion right now.
Okay, there's a motion made. Supervisor Schaefer, but the motion to refer to committee is preferential, and that will, in fact, take preference. Supervisor Boots was the motion, and Supervisor Schaefer with the second to refer the resolution back to committee. Is there any?
Yeah, this is debatable.
This is debatable and discussion. Supervisor Johnson.
Thank you, Mr. Chair. I find it curious. I'm a little confused that everyone, some folks were ready to go ahead with the substitute as it was written, yet when part of the substitute is taken and added to the original, then all of a sudden it requires more study. I think we're all pretty clear on it. I think the portion that Supervisor Rosenberg proposed adding to the original resolution has broad consensus as being a positive, and I don't think further study is really warranted. And again, it's putting us in a terrible light, Mr. Chair. It's putting us in that position of we don't have the guts to come out and take a vote and say what's right and what's wrong, and it's hurting us. And I wish we'd just stop and take a vote. Thank you.
Supervisor Boots.
I don't think it deals with guts. I don't think it deals with fear. I think it deals with, I don't think this is going to pass the way it's written right now, and I think we need to be in the middle somewhere. And I don't understand why sometimes we dig our heels in the ground and say, this is the way I want it, and it's the only way I'm going to put up with it. And I'm just saying to go back to committee because I feel if we do something at committee level, we can all come up with something that we can all agree on. And I think we should have done that back in the process early on. We did not do it, and that's why I'm putting it forward. If you want to vote today, go for it. I'm ready to vote.
Supervisor Johnson.
Thank you, Mr. Chair. With all due respect, that we're designating June as Pride Month. What month is it? I believe it's June. If we send it back to committee, it comes out in July or August and loses all meaning and loses an opportunity. And I would hate to see that happen. So I would be, vehemently against sending it back to committee. I think we've discussed this issue more thoroughly than just about any issue that's come before the board in the past year and a half. So I hope it does not go back to committee. Thank you.
Is there any further discussion? Supervisor Leahy.
Yes, thank you. Just another question again, I guess. When we say this is going back to committee, it will go to the Diversity Affairs and then proceed to Education, Extension, and Economic Development. Will it follow the same process that it followed the first time?
Yes.
Any further discussion? Any further discussion? The motion before you is to refer the resolution as amended back to the Diversity Affairs Committee for further work. Are we ready to vote? All right, we will proceed to vote. Aye vote refers it back to committee. A no vote, we will continue the debate. And we will proceed. And the ayes fail, and so it is not referred back to committee. We are back at discussion as amended. Okay, so where we're at is the motion to amend that was offered by Supervisor Rosenberg and seconded, and we have not voted yet on adding that amendment to the original resolution. Supervisor Johnson.
No, I apologize, Mr. Chair, that was premature. I'll pass.
Supervisor Mask. Any further discussion on the amendment to add the last two, be it therefore resolved, from the substitute resolution to the original resolution? Any further discussion? Any further discussion? Seeing none, we will proceed to vote. And we will proceed. And the motion is carried. Now, any further discussion on the resolution as amended? Supervisor Mask.
Thank you. And I appreciate everyone's comments tonight. I know this is not easy for people, and I question whether this should be put in front of our county board because it approaches religious values and divides people, and we need to separate state and church. We need to take religion and sex out of the issue. This is not about sex. This is not about people who have psychological problems. This is not about perverted lifestyles, nor is it pandering to people. I believe God created everyone in his image, as it says in the Bible. Over 30 years ago, the son of a prominent physician in the Wausau area came out to me. At the time, I didn't think too much of it because I really liked him, and it didn't matter to me he was gay. But I knew long before that there were people who were different from me, and I was okay with it. He left the area because he knew he would never be accepted here, and that's truly unfortunate. So over 30 years later, there's still hate and misunderstanding. This wonderful young man was someone's child. He could have been my child. He could have been your child. I found myself saying, wow, I'm really lucky he isn't my child because of all the controversy and the hate. But he was someone's child, and so is everyone else's, and they deserve our respect. I have personally been offended by people of every color, race, religion, profession, and lifestyle. So I guess that makes us all equal. The law requires us to be fair and inclusive in employment. This resolution would show that we are inclusive to all regardless of their background. Does it help our economic development? I'm not sure. I think a living wage would be more important to promote economic development. $15 an hour is not a living wage. But if we're going to be an inclusive society and an inclusive county, we need to be inclusive of everybody. Thank you.
Supervisor Zhang.
Thank you, Mr. Chairman. First and foremost, I want to thank Chairman Gibbs for the efforts and everything you and the leadership team has done to try and mediate this situation, negotiate. Like I said at the last meeting, I just want to say a thank you to each and every single county board supervisor, whether you agree or disagree with this resolution. You know, I really love the quote where that was mentioned multiple times about God making no mistakes. I think it is not a mistake that this resolution is brought up upon this board, because I think this board is given that right, that responsibility to decide on whether the LGBTQ community will be welcoming Marathon County here. This resolution, as I have mentioned at the last meeting, this resolution is not asking you to decide whether it's right or wrong to be a member of the LGBTQ community, but to decide and make a statement, a declaration that Marathon County is a welcoming and inclusive community. Marathon County is a beautiful and inclusive community. Let's keep it that way. Thank you, and vote in support of this resolution.
Supervisor Krause.
Yes, I'm also voting in support of this resolution. This is not a religious issue. I don't believe it is. As far as I know, God does not have a body. God is not male or female. And if we are in God's image, it is our soul. I think that's what I was taught. I do not believe God is male or female. And I'm not sure what the LGBTQ community thinks is their God, but I'm sure some of them go to church and are accepted by our communities there. Thank you.
Supervisor Schaefer.
Thank you, Mr. Chairman. I'd like to make an amendment. On the 1, 2, 3, 4, let's see, 2, 4. On the 7th whereas, it's got the 2019 Economic Development Strategic Plan. If you go down to the, says competing successfully for top-tier talent will require that the greater Wausau region bring in non-traditional workers to attract and retain skilled workers from outside the region. Delete that word non-traditional. I'm not sure what a non-traditional worker is, so why have it in there?
Is there a second to the motion to amend to remove the word non-traditional worker in the seventh whereas? Supervisor Johnson, or excuse me, Supervisor Robinson with the second. Any discussion? I seen his hand first, sorry. Supervisor Lowe. Any further discussion on the amendment to remove, again, the word non-traditional worker to attract and retain skilled workers from outside the region in the 7th whereas? Any discussion? Supervisor Johnson.
Yeah, I was just curious, like Supervisor Schaefer, what does that mean, non-traditional worker? I mean, a worker's a worker, and yeah, so a non-traditional worker, I just don't understand what the significance of that word is. I wasn't there when the resolution was written, so I'm kind of on the same page with you, Supervisor Schaefer.
Supervisor Zhang.
Thank you, Mr. Chairman. Administrator Carr, correct me if I'm wrong. This phrase was pulled directly from the Wausau Chamber of Commerce strategic planning, economic development strategic plan. Am I correct?
Yes.
Because of that, I would actually encourage to just leave it in there to be consistent with the strategic plan that was developed by the Wausau Chamber of Commerce, so that we're all consistent throughout.
Supervisor Schaefer.
Thank you, Mr. Chairman. The reason I mention that is if we're going to talk about the LGBTQ+, it kind of connotates to me that if you are a member of that minority group, you're non-traditional. I don't believe that's right. I mean, they work the same as anybody else.
Supervisor White.
Thank you, Mr. Chairman. The only comment I have is if you strike that word from that sentence, it really doesn't make a lot of sense because it leaves a blank. And it strikes me as not being complete and doesn't, that's just my thought.
The chair says that the motion was made and seconded, and it is not for me to decide. It's the body to decide on how the whereas is to read. Supervisor Zerini.
I think the intent of that, and in using the terminology that's in that document, a non-traditional worker is not somebody that goes to work at Monday morning at 7 o'clock and works 8 hours and then does that 5 days in a row. They're talking about people that are working on their laptops in coffee shops. They're working in their home. They're in the Gears Center, renting spaces, the entrepreneurial center. They're individual contractors. They're not traditional employees in the sense that they have contracts. They're not covered by health insurance benefits and other things. And it's kind of the trend in the workforce today. You can be a non-traditional worker and your employer can be in San Francisco and you're housed here in Wausau, Wisconsin.
Okay, Supervisor Stark.
I withdraw it's been covered.
Supervisor Krause.
Having been president of the National Organization for Women in Cleveland, Ohio, for several years, what non-traditional meant at that time was that men would go into what was considered female realms of work, such as men would become nurses, men would become hairdressers, and then women would go into non-traditional fields, such as women would become doctors, women would become lawyers. So that's what I'm thinking of when I hear the word non-traditional roles or non-traditional workers, is that there's both male and female become roles or careers, have careers in what was considered a male area or an all-female area. Thank you.
Supervisor Zhang.
Thank you, Mr. Chairman. Administrator Carter, can you provide some clarification? I know you participated with the Wausau Chamber's economic development strategic plan.
Yes. First of all, let me point out that if you click on the language, the blue will actually take you up to the plan. You can read it yourself. It's a direct quote out of the plan. When they use the word non-traditional, I think they mean the things that Jeff Zerini was talking about. I also think they mean minorities. I also think recruiting markets that are different than just what we have always done in the past.
Any further discussion on the amendment? Again, the amendment is to remove the word non-traditional. A aye vote will remove the word non-traditional. A no vote will leave it intact in that whereas. Are we ready to vote? All right. Let's proceed to vote. And we will proceed. The motion fails. The Any further discussion on the resolution as amended? Supervisor Gumbs.
The question I was thinking about here, as you discussed all the things we want to do to get people involved, to figure things out, isn't that a year-long process, a constant process? Why is it really called June Respect Month? Why is it not just a day and a year-long effort to do all these things? I don't,
First off, let me clarify, we are not, the resolution is declaring June as Pride Month in Marathon County. We are not as you had referred to.
Oh, excuse me, but I meant, it's getting late.
Yep.
I meant, why is it a monthly thing rather than one day, but a yearly process? Which, when we go through the grocery list of things that need to start getting done, it's a lot of stuff that ain't going to be done in a month. It's going to go on and on and on. That's my question, if that's a question.
You're absolutely right. When I looked at this issue, I felt that this board and the community missed an opportunity to have open communication and open dialogue and understand and educate itself before it took up this issue, so that we were clear on what, when we were using terms, that we were clear and understanding. That was the spirit of which I offered, and we will move on. Supervisor Lowe.
Thank you, Mr. Chair. I really don't need a resolution to tell me that we need to be diverse and inclusive, but apparently we do need a resolution to declare that, you know, our LGBTQ community does need to be respected in this county. So I don't need a resolution to tell me that we need to be diverse and inclusive, because I can do that on my own. And I think everyone here is an adult, I can do that too. And we all don't need a resolution to tell us to do that. But we obviously need a resolution to tell us that we need to give our LGBTQ community some respect and make sure that they're safe in this county and that we do need them here. So.
Supervisor Zerini.
Thank you, Mr. Chair. Last Thursday night, we heard a lot of passion, a lot of discussion. I asked the question at that point of why are we entering into what I would consider a partisan issue, one that clearly is in the media, and it's one that I raise a question as to why we're getting involved in it. I personally know of success stories in the community that people in the LGBT community that are successful business people in this community. I'm a business guy, and if there's a problem, I say, why don't we fix it? I don't know if this resolution's going to fix the problem. If clearly there is a problem from those people that spoke, then why don't we take some action and have some processes in place to get at that? I'm not sure a resolution in itself, the wording on a resolution will do anything but become more divisive in the community. I'd rather have some committees get at, roll up their sleeves, figure out what's going on, where are the areas that we need to, the community engagement part of this, and get at it, and not get the community all worked up.
Please, Supervisor Johnson.
Thank you, Mr. Chairman. I would say in order to first solve a problem, we must recognize it's there. We must acknowledge it, and I believe that's what this resolution does. It acknowledges that there is a problem there, and this is a first step towards moving towards resolution. And with that comment, I'd like to call the question.
Is there any objection to question being called? There is objection. We will proceed. We need a motion and a second. Supervisor Johnson, are you making a motion?
Move to close.
Is there a second? There was objection. Is there a second to end debate? There's a second to end debate. It is not debatable, but it does require 2/3 majority to end debate at the will of the board.
Just a second. There's nobody on the queue right now.
No, there was nobody on the queue. Okay. I was just checking, our board rules require that anybody that had still been on the queue, had requested to speak, would be allowed to be recognized by the chair to speak. At this point, there is nobody. The motion has been made and seconded. We will proceed to vote. It does require 2/3 majority, aye, to end debate on this issue. So we'll proceed to vote. And we will proceed. Okay, the motion is carried. We have 35 members present. 2/3 majority is required at 24. So the will of the board is to end debate and proceed to vote on the motion. And so there is no further discussion, and we will proceed to vote on resolution 33-19 as amended. Is everyone clear what they are voting on? Is everyone clear? We're voting on the declaration of June as Pride Month in Marathon County as amended, including the further be it further resolved from the substitute amendment that has been included in the amended original resolution. And I vote will approve that resolution. A no vote will defeat the motion, or the resolution. Are we ready to vote? Any further? There is no further discussion. We will proceed to vote. We will proceed, and the motion is carried. Moving on to item G, policy question, motion to determine whether NCHC should work with our community partners to facilitate the transfer of Birth to Three program. No, please. Sir, please. A motion to determine whether NCHC should work with our community partners to facilitate the transfer of Birth to Three program from NCHC to Marathon County Special Education. Motion by Supervisor White and second by Supervisor Wagner. Any discussion? Supervisor Schaefer.
Thank you, Mr. Chairman. Is there any cost savings by fled is a lot from the school districts? So why are somebody on a committee give me a reason why we should do this? Or Mr. Chairman?
The discussion that was brought forward is it's a natural fit and it's a continuation of services to that community when it's from birth to three, and then they go into the special education programming. So it was a natural fit. There's no cost savings, but again, it's a natural fit to transfer that or potentially look at transferring that program from NCHC and it was also looked at as far as the facilities needs and the renovation, and it was the appropriate time to look at that. The other two counties that are partnering in the Birth to Three have already moved to forward and continue the exploration of transitioning that.
Follow up. So the employees still are being transferred, or are we deleting any employees?
There will, again, the employees that are responsible for that program are transferred directly to, correct, and there would be again, no savings, but there will be less NCHC. Again, it's the same three counties. And clearly, at this point, there are still contingencies that have to be met. There's departments that have to approve that transfer. And so this is a policy question, is should we continue to explore that transfer of that program? So it has not been, at this point, a final approval. That will come back to this board at some future point. Okay, any discussion? Any discussion? Seeing none, we'll proceed to vote. And Supervisor Zerini? There we go, thank you. And we will proceed, and the motion is carried unanimous. Item H, miscellaneous, announcements and/or requests. Any announcements and/or requests? Supervisor Robinson.
Just for clarification on the last vote, so the documents raises the question of should we do that? It really wasn't an affirmative vote. We approved a question. Was that our intent?
I took it as an affirmative motion. I know I was looking at that, and I believe that was the intent of the motion.
Would we be better off reconsidering and reframing?
If you would like to do so,
we adopted a question.
Prepared to talk to that, yeah.
You know, and I think the intent was for us to advance the purpose, and I need to have somebody go back in and raise a question because we adopted a question.
Everybody had voted in favor of it, so anyone can bring a motion to reconsider on this particular issue.
And can we do it right now?
You can.
I would move to reconsider the motion by adopting the question.
You can't cancel the vote.
Instead of should they direct them to? It's a question. Approve their explorations. As you could say it.
Is there a second on a motion to reconsider? And Supervisor Boats is with the motion second to reconsider. Now, as Supervisor Robinson points out, if you wish to address the issue.
I would encourage you to vote to reconsider, and then we should reframe the motion to approve continuing with discussions relative to the transfer of the program.
Okay, so the recommendation is vote yes to reconsider, and our voting system is locked up. We are going to do a voice vote. Is there any further discussion on the motion to reconsider? All those in favor of reconsidering the last vote on the motion to determine whether NCHC should work with our county partners to facilitate transfer of birth to 3, signify by saying aye. Aye. Opposed? We are back to now where we were, and that was a motion was made and seconded to approve a question. So do we want an amendment to the motion? Supervisor Robinson.
I would move to amend the motion to delete the words motion to determine whether and should, and insert Marathon County Board directs NCHC to work with our county. So you're deleting the words motion to determine whether and should, and inserting Marathon County Board directs NCHC to work.
Okay, motion has been made and seconded to amend to include, to delete the words motion to determine whether, leave NCHC there, and remove the word should, and put Marathon County Board does.
Marathon County Board directs NCHC to work with them.
Okay, so Marathon County Board directs NCHC to work with our community partners.
And to delete the question mark and replace it with a period.
And change that question mark to a period. Is there any further debate? Oh, is there a second first? Excuse me. Second by Supervisor Zereni. Any further discussion on Supervisor Zereni?
I just want to add that the other 2 counties already have approved it, so that was a good catch by Supervisor Robinson.
Okay. Any further discussion? All those in favor of the amendment signify by saying aye. Aye. Opposed? The amendment passes. Now, any further discussion on the motion as amended? Any further discussion on the motion as amended? All those in favor of the motion as amended signify by saying aye. Aye. Opposed? Motion carried. Thank you. We are now down to item H, miscellaneous business, announcements and or requests. Any announcements and or requests? Supervisor Durham.
Thank you, Mr. Chairman. Just since we're not going to meet until after this is over, there is going to be a Warbirds Flying at Seaway on July 20th, right, which is a Saturday?
27th, I believe.
Is it? I thought it was the 20th. Do you remember, Jeff? Oh, right, the 20th. Yeah, it's the 20th, and there'll be food and all kinds of things there. There's supposed to be a flyover by F-15 flight from Duluth and so on. And the other thing is any profits from donations and so forth go to the never to be forgotten honor flight. So it's a worthwhile cause, and of course, we all want to hope for good weather. Thank you.
Okay, any other announcements and or requests? Excuse me, Supervisor Sly.
Thank you, Mr. Chair. Yeah, Friday, if you remember, is Jamie Polly is setting up a tour of some of the parks on the eastern or western side of the county. So if that'll be Friday, I believe it's 10 o'clock. They're meeting at is leaving at 10 for Marathon Park. Thank you.
Okay, any other announcements? Supervisor Krause.
Thank you. I would like to invite everyone to the Disability Fibromyalgia Support Group meeting, which is being held at the Marathon County Public Library, Wausau Branch, July 9th, which is the second Tuesday of every month from 6 to 8 o'clock, second floor meeting room. And the topic is going to be a healthy gut with probiotics. Thank you.
Any other announcements and or requests? I have announcements, need signatures from the administrator, from the chair, from Health and Human Services, from Human Resources, Finance and Property Committee. The resolution that needs signatures from the Diversity Affairs Commission, Extension, Education, Economic Development Committee will be held off until we get the amended resolution typed up, and then there will be an email circulated to request those committee members to sign the resolution. Any further discussion, or excuse me, any further announcements? Seeing none, we are down to item number 19. Motion by Supervisor Bowl and second by Supervisor Zhang to adjourn. Any discussion? All those in favor of adjournment signify by saying aye. Aye. Opposed? Thank you, ladies and gentlemen. We stand adjourned.